Hello, I'm Kim Castleberry, and I'd like to demonstrate for you today how you can use Uprise EHR for subspecialty care. We're going to start with dry eye exams. Dry eye exams can be done in a very comprehensive way and also easy. And it starts with up here in what and when with exam type. While I've got loaded in here a comprehensive exam with these selected groups for this particular exam type, I also have dry eye exams loaded as well. And you can put those in and it'll have a pre-selected amount of groups for dry eye exams. But we didn't know this patient was coming in for a dry eye. They were set up for a comprehensive exam, so we'll leave it like that. In chief complaint, we do have support for many chief complaints in here. Many of them are dry eye related. You just smart search for them in here. Add them, select a primary. Here we've got dry eye as the primary chief complaint with red eye, sandy, gritty feelings, blurred vision, watery eyes. And again, you just select those and you can go through the HPI selection tool to complete those. We also have dry eye support in our past family and social history. Dry eye support is present in patient ocular surgical, family ocular surgical, as well as the patient medical history. We also have allergies here, medications, and in medications we have, in my case, I like to put my non-prescription medications in e-prescribing so they display here. And they're sorted, as you can see, according to ocular medications. So I have both my prescription medication list and my over-the-counter medication list. I make it a habit to always prescribe my over-the-counter medications because they are in e-prescribing, and it gives a great way to document exactly what you've done for the patient, and it gives a written record for both you and your patient. And in screening procedures, you can see here we've got our Optimaps screening procedures, coronal topography, and wavefronts, which are helpful with dry eye. And in this case, we've got noted here ocular surface disease, distorted wavefront topography. But the heart of specialty care can be found through other tests. Other tests are non-coded tests that are specific to your practice. These are user-defined, and while it will come shipped to you with a lot of user-defined tests, you can edit them at your discretion. And you just hit the add here and you can see all of the special tests that are going to come shipped with the Uprise EHR. Mammography, tear breakup time, tear meniscus height, tear test, vital dyes, and some accommodative facility test, auditory analysis skills tests for things like low vision, carotid artery, auscultation, color vision, confrontations, developmental eye movement tests, and so forth. And again, we've got neuro testing items here for central nervous system testing, cranial nerve system testing, 3-parks test, versions and motility, the vertigo testing with Dick's Halpiki maneuvers, and all kinds of oculoplastic and other subspecialty training tests as well. Again, they're user-defined. You can add and subtract whatever you want, but you can add these to your exam type, or you can select them on the fly by selecting the plus. So here we've got dry eye report defined, and a real easy way in terms of workflow, if you have the dry eye technology incorporated into your practice, you can simply do the dry eye test on your machine and attach the report if you'd like. And in here you've got all the data that you would need to look at it. Now if you do want to define the fields, you can also do that as well. So here you can see I've got tear film analysis, and we've defined the tear breakup time for 3 seconds for both the right and the left eyes. And we've got the evidence documents with special testing associated with it right here. And then we've also got tear breakup time, tear meniscus height, and again we've even got an image here to show what that looks like. And we've got mammography, and in mammography we've got here a 50% loss of glands, and the remaining glands are compacted, and we've got supporting evidence documents as well. And we've got tear testing, 20-second thread test in both eyes, and we have vital dyes showing 3 plus SPK, OU, diffuse, and scattered. And again, if you want to upload an associated image, you can click right here and do that. So again, the other test is the heart and soul of special testing, and you can see here where we've got all of our dry eyes on this particular exam. The physical exam is where we put all of our coded problems in the physical exam. We can also document normal and abnormal findings in addition to the coded findings as well. So let's see how that looks. So again, we know that once we've examined the patient, we have abnormal eyelids, lacrimal system, conjunctival findings with redness. We know that we have some rosacea findings, and we have some systemic issues with the Sjogren's syndrome, and of course we have dry eye. So we're going to cycle through this, and we're going to go through this slowly. We're going to deconstruct this so you can kind of see what's going on. But with unspecified blepharitis, we'll select moderate. And if you want more detailed findings that you don't really need to or may not be associated with a code, you can do that right down here. So here we've got 2+ meibomian gland atrophy and 2+ scalloping. And we have collarettes on the left eye. So again, you can just enter those here as non-coded findings, and they'll display as that. And again, we've got some ocular rosacea here. Go to the next one. We have Sicca syndrome with keratoconjunctivitis, and we have epiphora due to excess lacrimation. Cycle through that, and we've got conjunctival hyperemia. Again, if you want to get more detailed, you certainly can do that down in here. And we've got rosacea right here. Moving on to systemic, we have our Sicca syndrome, our Sjogren's syndrome right here, and Sicca syndrome with keratoconjunctivitis. And again, our dry eye syndrome, we've already selected that with lacrimal, so we'll deselect that and select finish. And again, then we just simply go down here and we can see all the physical exam findings, including the detailed findings right here. We do need to select a primary diagnosis so that the insurance company will be selected. And in this case, we'll do a Sicca syndrome with keratoconjunctivitis. And you can see here we have that. We have our optical diagnoses. We have our unspecified blepharitis. And if we select on that, we can see that the underlying SNOMED CT code, where we've attenuated the diagnosis a bit, is meibomian gland dysfunction. And in this case, we've got it selected as a default. So anytime I select blepharitis, it's going to put meibomian gland dysfunction as the default. And of course, if we want to put another kind of blepharitis in there, we can do it right here by selecting them. If we want to fine-tune the plan or get rid of things, we can select and throw in the trash can items that we don't want that come in the default plan for treatments on this. If we want to add free texted treatments, we can do that right here. Put them in the chart. And we can see here we've got epiphora due to excess lacrimation. We've got conjunctival hyperemia. We've got ocular rosacea here. We've got facial rosacea here. And of course, we have the underlying systemic condition, Sjogren's syndrome, right here. We can look at the special tests that have been selected for use here and take a look at them. Again, the interpretation report is already done. And the evidence documents have been attached by the staff right here. And when we go down to orders, these are the orders that we would be selecting to be done today or to be done in the future. So you can see here we did external photography, we did meibography today, and we're also going to schedule that for a repeat test in the future. Our medications that we've prescribed are also here. We've also seen any communications that we've sent to any other provider right here. So I'm sure we sent the rheumatologist a note about the dry eye here. And again, we've got a new goal section. I really like this because this lets us keep in mind what our goal for this patient is. And this is a severe dry eye with keratoconjunctivitis sicca secondary to Sjogren's syndrome. So in this case, we're going to manage for pain-free eyes and clear vision with daily bandaged contact lens use. We've got our patient counseling items right here that can be selected. So let's educate our patient about Sjogren's syndrome and rosacea and meibomian gland dysfunction and rhistasis. So I particularly like the patient counseling items that Rendia gives us that are eye care specific. We can actually show the patient what's going on with their meibomian gland dysfunction. Let me show you how that looks.
Healthy tears consist of a precise mixture of oil, water, and mucus. Meibomian gland dysfunction, also called MGD, is a condition where the meibomian glands do not produce the proper quality or...
I won't make you suffer through that whole video, but patients really like it. And I think you'll enjoy the fact that you'll be able to step away from the exam room, let your staff finalize the exam, show them that display, or this actually will be sent to the patient portal. So the patient can log on to the patient portal as well and view that video later. Another quick tip for patient counseling. Eye annotations can be used not only for documentation purposes for the case you're dealing with, but also patient education. And let's see how that looks like, for instance, with eyelids and lacrimal. You'll see here that we've got the eye annotation icon. You can select those to document your problems. And they're available for most other conditions as well. Process that, and you can take, for instance, blepharitis, and you can kind of draw the patient what's going on with their blepharitis, explain to them what's going on, document the severity, and at the same time you're educating them about their case, you've documented and coded it as well. Moving on to the next one where we might want to do epiphora due to excess lacrimation, we can drag that over to the eye that it's dealing with and set their severity. And then we can explain to them why their eyes are overproducing tears. The glands right in here secrete too much water in here. It lines up and it goes in through the glands and down into the nose, but the excess water is running down the tears and cheeks, and that's what's going on. At the same time, we can talk to them about their glands and why they're getting plugged up. So you can see how these annotation tools are not only a great way to document the case, but at the same time you're doing that, at the same step, you can also educate the patient about what's going on. And again, you'll see here that the coding is already done for you. Because you've selected a primary diagnosis as medical, it's taking the primary diagnosis, assigning it to the primary medical insurance company, and the medical special test, assigning it to the insurance company, and the other things that are either no charged or like the Optimap here is going to be going to the patient. So I've kind of deconstructed this dry eye exam in a detailed way, taking a little bit of time so that you can see how detailed and how comprehensive yet quickly you can document a subspecialty exam like dry eye care. The efficiency of Uprise EHR really starts to shine on follow-up exams. So I'd like to deconstruct a follow-up visit so you can see what the workflow looks like and how well it works. So here we've got a patient coming in for a dry eye exam type, which means it's already got the groups selected for a dry eye exam. And the reason for the visit, the chief complaint, is a dry eye. And if we want to get a clue for what they were in for on the last visit, we can go to problems and procedures, and we can see selected and diagnosed by date that they came in, and these were the things that we were dealing with. Meibomian gland dysfunction, dry eye, epiphora, and hyperemia, punctate keratitis, and so forth. If we want to see what the plan was on those visits, you simply select and you can see what the plan was for these visits. And in this case, we had done some tear testing, vital dye, warm compresses, and lid hygiene, and we have them returned for today. If we want to see what kind of procedures have been done, we can jump down to screening procedures, and we can see our other tests, the things that we talked about earlier in the video, and we can also look at procedures for a coded test, and they will all be right here. Again, so we could go ahead and bring up the exam, And we can see here they're in for a dry eye exam. And these are the groups that are pre-selected for dry eye exams in my EHR. And the beauty starts right here because you don't have to add in NT Chief complaints unless there are new ones. You simply go hit the history icon and you select the ones that you want to deal with today and you process through the HPI again. And simply just updating anything, whether it's improved, worse, or whatever. Select that. And now you've got notes here that they've been reviewed today and the complaint is still active and it's got any changes that you have today. So we can see this young lady here is still having difficulty with her dry eyes. So we'll look at the PFSH quickly. We can see what's going on here. And I'm going to decide to go ahead and do a complete review of systems because we're really not making a lot of progress here. So we'll go ahead and process and deconstruct the review of systems. And again, we've got pertinent and support for the level of the 5 levels of evaluation management codes if you're using those. But in this case, we've got abnormal allergy and immunologic. She's got hives, eczema, and rash histories. And she's got an abnormal endocrine system with heat and cold intolerance, and she's thirsty a lot. The GI system, genitourinary system, the ear, nose, mouth, and throat. Actually, she's complaining of a dry mouth. So we'll put dryness here in the mouth. Makes sense because she's got Sjogren's syndrome. And the skin system, again, she tends to get dry skin, and all the other things are normal. So these are reviewed. So again, we have really good review system support for dry eyes right here. And again, the allergy history is here. The medications, again, on Refresh, Optiva, and Restasis. And the vitals are all right here. We can see our other tests. We went through those last visit, so we won't belabor them here. And again, the beauty of follow-up exams is you don't need to go through the category selection again unless you want to. It's easiest just to select the history button and select the items that you want to address on this particular visit and process through them. And again, all we have to do is select a primary diagnosis. And because the supportive therapies didn't make a lot of improvement, we decided to add bandage contact lenses, and we decided to add punctal plugs to this visit. So let's see how we do that. All we have to do is select these things right down in here, and they will automatically display up here in procedures. We can see here that our 92071, our contact lens, bandage contact lens, is already done here automatically, our procedure for that. And we've got punctal plugs right here, and we simply add in our plugs E2 and E4, and it will automatically reflect the correct diagnosis and the correct quantity on the coding area that goes over to the invoice. And again, we've got all the same counseling items that we've got here again. And we go down here to coding, and we simply add our 25 modifier because we're managing lots of things other than just punctal plugs here today. So we're going to bill the visit in addition to the bandage contact lens and the punctal plugs. So again, we sign that, and we're done, and all that goes over to coding. So again, we took a little time to deconstruct this dry eye follow-up exam so that you can see how well, how detailed, but yet how efficient we can document subspecialty care like dry eyes. Again, we've got more coming. Stay tuned, and you'll be able to see other subspecialty tests and how Uprise EHR takes care of those. I hope you enjoyed it. Good day.